Hi, my name is Thomas DeSanto. I'm one of the clinical educators here at Cooper University Healthcare, and I'm here with Patrick Matlack, one of our other educators, and we're here to talk to you and give you a few tips and information about Cooper University Healthcare and what it takes to be a MedSurg nurse here at Cooper. Some of the things that make Cooper unique and a great place to work is that Cooper tends to be a great place for hospitalists and for patients to come. We have a diverse population that comes here, including inner city. We have people that come here from all over South Jersey for trauma care. We also have people that come for surgeries, and for bariatric surgeries we have an active cancer program. And we also have a high volume of cases that come through for patients that are seen here through our emergency department that service the general population. So if you're interested in applying here at Cooper as a MedSurg nurse or in any of our positions, our links are down below at the end of this video. But I also wanted to give you a little bit of background about our hospital and a little bit of background about myself and Patrick as educators here. Been a nurse for 25 years here in South Jersey. Came to Cooper because of the level 1 trauma certification that they have. I also was interested as this is a teaching facility. Our associations with Rowan and Rutgers University nursing schools also made this a very attractive place for me to work that I was really interested in. One of those things that really makes me feel good about being a MedSurg educator is that I always wanted to be an influence for the newest nurses that are coming into the field. I feel that shaping that newest generation gives us an opportunity to make nursing everything we want it to be. So I also wanted to sit there and introduce, again, one of my co-educators. This is Patrick.
Hi, my name is Patrick Matlack. I'm a clinical educator here at Cooper. I am an educator on Kellerman 8, which is a tele-med-surg floor. I came to Cooper to work at a large acute care hospital. As Tom said, we have a large diverse population. We have a high acuity of patients, and we have a lot of new nurses. It gave me the chance to work with those nurses and work with those high acuity patients. So it's been a great experience for me. I worked as a floor nurse for many years, as a med-surg nurse. I think it's a great opportunity to really learn a lot and gain a lot of experience. If you work on a med-surg floor, you have to learn a lot about a lot of different things. You're not focused on one thing. You're not working just with patients who do surgery or patients who have heart surgery. So it's a really great training ground. If you like to constantly learn new things, med-surg unit is a great place to work. And
Totally
Cooper is a great place to work because you see a large variety of things here at Cooper. As Tom said, we have the cancer center. We have a large cardiac surgery program. We have a large number of surgeries, neurosurgery, orthopedic surgeries here. So people come here for a lot of different things, and you'll get to experience those as a nurse here.
So that's a great way to ask that question. So what do you think it takes to be an excellent med-surg nurse here at Cooper as compared to, say, a community hospital in the area?
Well, as I said, we have a very high acuity, more than you would see at those community hospitals. You'll see a lot of different areas, as we mentioned, the surgeries and the cardiac programs. But as a med-surg nurse and one here at Cooper, we're looking for people that are very hardworking, who can be an advocate for their patients, a strong advocate, somebody who can be really focused on the task at hand. Because of the acuity and the number of patients we have, we need people that are really good at teamwork. You have to work as a team. That includes working with all of our different doctors, working with our transporters, working with our therapists, all the different therapists, occupational therapists, physical therapists. It's one large team here, and we all work together, and we want to work together well. We need somebody who can deal with high stress. As I said, the number of patients we have here are a lot of them have high acuity levels, so you have to be able to deal with stress. And really, I look for people who are always striving to increase their knowledge base. I think that's so important in nursing. A lot of times, I've seen nurses who come out and say, I've graduated, I've passed the NCLEX, I'm done learning. Nursing is a lifelong learning process, and anybody who doesn't want to be involved in that is somebody I don't want to have here at Cooper. So, and some of the other things we have for the newer nurses, Tom, is we have a clinical ladder program here at Cooper. So as they gain experiences, they work on unit-based councils, they participate in committees, they have a chance to move up the clinical ladder, which also increases their salary. There's a monetary component to that. We also have a nursing residency program here at Cooper. It's for new to practice nurses. They participate in this program for 1 year. We focus on things like evidence-based practice, leadership, delegation, communication, teamwork. And at the end of that program, they present a poster on a topic that they've selected and work together as a group. And these are presented at our quality nursing leadership meeting each month. And a number of those projects have actually been put into practice here at Cooper. So that's a great opportunity for nurses.
That's an excellent point. I mean, advocating for our patients is something that we always want to do. We have such a diverse population when it comes to some of the disenfranchised populations. We have a large catchment area for nursing homes. We have an indigenous homeless population that's in the area. We're in an inner city area. Those being an advocate in a MedSurg area or in a MedSurg environment is really, really important. And that's where our nurse residency program comes in, I think. We get to have our nurses truly speak for our patients, make sure they get the services and the requirements that they need, not only for treatment here, but for discharge as well. Our clinical ladder, I'm a strong advocate for the clinical ladder. I've spoken to it quite a bit. I know that we offer training and education for all of our nurses that come through, especially when it comes to things for certification once you reach requirements for your time here. MedSurg is a certification as a specialty environment. That's something that I truly believe here at Cooper we're striving towards. It's very easy to say that you're clinically a specialist as an intensive care nurse or as an emergency room nurse or even a trauma nurse, but it's very often overlooked that MedSurg nurses are their own specialty and their own subset. They see patients and deal with environments of care and deal with different diagnoses that even in critical care, they have more resources that they have to call to themselves. They need their own assessment skills, whereas you have more monitoring and you have more equipment in an ICU where you do in MedSurg. You have to use your true nursing skills and your true assessment. I really agree with you there.
Yeah, that's very true. I myself am a certified MedSurg nurse, and I'm very proud of that. Like I said, to be a MedSurg nurse, it's not being focused and having a great deal of knowledge on one subject. You have to have a broad base of knowledge on a lot of different areas, okay, that comes into care with people. So I think that's something that's really important.
Absolutely. Yeah, it's interesting to me that when you look at certain like low volume, high acuity things, like what comes to mind especially is peritoneal dialysis, as we have a population that comes to the hospital now for us, especially here at Cooper, that gets peritoneal dialysis. That's not something that you see every place, but that's something that's almost exclusively MedSurg, where you would see that on a medical surgical unit. You have to treat and do that procedure that a critical care nurse would be doing hemodialysis or CRRT, chronic continuous renal replacement therapy. So I really agree that MedSurg really has a focus here at Cooper, and the opportunities that we have that are open for nurses coming in, either fresh out of school or who are looking for that higher acuity patient. I think that there's a lot of opportunity here for Cooper.
Yeah, there's a very large opportunity. And then further down the line, you can focus on certain areas. But, I found for myself, I really enjoyed that broad area, getting to know a lot. I'm always a person who's always trying to learn new things, and being able to see all the variety of diagnoses and caring for all those different patients, I think is great, and keeps me on my toes.
No, absolutely. I totally agree.
So, what would you say about the candidates when they come in, what they could expect for the interviews, and what they should do if they want to apply for interviewers?
I have to say that if you're expecting to come in and just, it's a MedSurg position, that it's kind of a shoe-in. I just started and they'll hire anybody. I don't really agree that that's true here. I think that our interview process and our screening process, even pre-application or during application, is very thorough, and that we look for the best nurses to come in. I think that if you have that drive and that desire to excel, that you'll do very well. Those are the things that we're looking for when we're interviewing, that we're looking for the type of people that want to be in a growth environment. As a medical school, as Cooper is a university healthcare setting, we're looking to educate. We're looking for people to be at the forefront. We're looking for research. We're looking for people that are using evidence-based practice the best way that they possibly can. So when you're interviewing for the positions that are even open now, I think that having that desire to learn, having that desire, as you said, to learn new things and experience new things is important. And that's when you're interviewing, I think, would be important to see.
I think one of the other things we're looking for too is communication skills.
Absolutely.
Communication is so important. You have to be able to communicate with the other nurses. You have to be able to communicate well with the doctors. You have to be able to communicate with the therapists. You have to be able to communicate with the patients and their families. These people are sick. They're worried. Their loved ones are coming in. You have to be able to talk to them. You have to be able to explain things to them in a way that they can understand. In addition to advocating for them.
Absolutely.
So.
And that's absolutely true. We have a very large bilingual population, so that basic form of communication, we have an active translator course or translator department where we have
translators.
Deaf and mute people that they actually use for the computer for sign language, American Sign Language, bilingual translators. That's a big deal. And then having nurses that can actually explain things in a down-to-earth way so that they can have those patients understand what they're leaving in their discharge instructions. I agree. Yeah. I really think that nurses that come to Cooper are looking for that experience, and I think that people applying would want to experience the level of acuity that Cooper has to offer. We're a university setting where we have trauma patients, yes, but we also have patients that are at the forefront of medicine and the things that we treat for, whether it be cardiac, sepsis, or any of those other diagnoses. So, and that's one of the things I actually love working at Cooper for, is that it's never the same day twice. There's always something that's going to be there that I either had to learn about or I just came in contact with, a different kind of a piece of equipment or a different procedure. Take your pick, ventriculostomies that you don't often see. You have patients that are coming through hypothermia protocol after having an MI or a heart attack, or they've been resuscitated in the field. You see patients getting acute treatments that you wouldn't see other places that get translated into practice here. And those patients come to the MedSurg units, they come to every unit, telemetry where you see arrhythmias that you wouldn't normally see. That to me is why I love Cooper, because then you also have that fostering relationship with the people that you work with. They'll take you by the hand and say, "Oh, you've never seen this before. Oh, this is really cool. You want to check this out, or hey, I just look it over here. Let me show you how to do this a little bit easier." And that's not something that you get every place. That's one of the things that make it really nice for Cooper.
Yeah, no, I completely agree. At other hospitals, you might hear about these. You might hear a doctor tell a story that they saw this once in their 20 years of practice. But here at Cooper, you will actually see those things. And it's a great learning opportunity. And people are willing to take you aside and show you things and teach you things. That's another great thing about working in Cooper. You learn a lot, but the people work together as a team, and they teach you and they share with you. That's one of the things I love about working with Cooper. We're all one big team. We all work together. We all have the patient's best interest, and that's what it's all about here.
Absolutely, and it's not just with the nurses, it's with the physicians too. There's a very collegiate environment, very collegiate relationship. Physicians that are willing to sit there and step up and say, all right, well, I'm learning how to do an ultrasound, or I can show you how to do that ultrasound guided IV, which is not a common nursing practice, especially in community hospitals. Or if you have physicians that are doing a procedure that'll pull a nurse aside and explain it while they're doing it, instead of just, okay, well, here it is, and now they're all yours. So it's very important. I really think that that's true.
Yeah, and that's what happens at a teaching hospital.
Yep.
You have a great opportunity to learn.
I agree.
And grow. So.
But I want to thank you very much. If we're interested in applying here at Cooper, there are links at the bottom underneath this video. It's been our pleasure to tell you a little bit about ourselves and a little bit about the opportunities and the things that make Cooper very special and a special place to work. And again, we thank you for your attention and thank you for watching.
Thank you.